Healthcare systems all around the world in every country are using a lot of legacy technology, legacy infrastructure, really old ways of doing things. And Lydia, with Pando, you're solving this problem with communications platform, helping to improve outcomes. And Saurabh, you're doing something from a different perspective with respect to getting GPs more accessible to people, to everyone. Now, Saurabh, I want to start with you. How is Babylon improving health outcomes?
We have telemedicine services where a patient can speak to a general practitioner or a family physician, and that family physician has access to the patient's healthcare records. So you can have a kind of consultation 24 hours a day, 7 days a week, 365 days per year. But also that physician is also empowered by some intelligent technology on the back end. So you have the convenience to the patient, but you also have the information that the clinician has. And so the patient is really supported throughout their whole healthcare journey, not just through the consultations which the patient's having with the clinician, but also through a series of AI-assisted technologies which support the user to ensure that they can monitor their health. And that information also goes to the clinician as well.
Lydia, how is Pando solving this challenge?
Clinicians, not only here, but all over the world, are suffering from a real lack of tools for the kind of communication that they need. So bespoke communication around a patient that delivers the functionality and security that healthcare demands. So we are essentially replacing some legacy systems, such as the bleep, which is a little plastic thing about this size that most doctors carry around with them. It displays a landline number, and you have to stop what you're doing and then go and call that telephone number to find the person on the end and connect with them. Our philosophy is that by supporting the people that look after others, we're helping the patient downstream. And I think in an environment where actually we don't have enough clinicians, we have to, just like Babylon's doing, make the best use of those resources. We can't afford for people to be wasting time.
What do you think patients can expect to be the improvement in outcomes using platforms like Pando or Babylon?
We allow a clinician not only to seek an opinion from one expert, so you come in with a knee problem and I need to consult an orthopedic surgeon. I don't just have to ask one, I can actually ask a whole group of them at once, which is quite exciting. We also, in terms of saving costs, we also save time for the patient. Those things tend to go hand in hand. Just like Babylon, if you enable clinicians to make better decisions, and that might be through AI, or that might be through better expert advice, then you reduce the number of referrals and outpatient appointments you need. One of our top sort of use cases is dermatology, actually. Primary care sending images of a disease or condition to an expert in secondary care. And instead of that person waiting 6 months for an appointment or going privately at great cost to themselves, they can actually get that opinion instantly.
Beyond that, it's also about giving the patient information about their healthcare. So one of the sources of anxiety that patients have when they have a concern is actually, how can I get reliable, trusted information about my health? What we do at Babylon is we provide not just the clinical services, but the AI-assisted services. And so what we have here is a great deal of curated medical content, which provides patients with information about their conditions, but also products which support those patients through their healthcare journeys. The products which we have developed are personalized to that individual and so therefore can provide information in a timely manner.
Yeah, I think that's really important. I think the democratization of healthcare data is something that I'm looking forward to seeing come to fruition. I think it's very, very frustrating for patients not to have the information they need.